Labor Day weekend signals the end of summer for many Canadians.
We're relaxing, having lunch together.
Health officials hoped people would enjoy it by maintaining social distancing and sticking with people in their own bubble.
Anything that anyone can do individually to reduce the risk to themselves to transmission is really important for Labor Day.
But that wasn't the case at this Toronto beach Saturday night. People partying without masks, no social distancing, and dancing in tight quarters. The majority of Ontario's cases continue to be in Toronto, Peel Region, and Ottawa, with outbreaks at weddings and a Toronto church led by a man who has serious doubts that health measures are even necessary.
You expect me to stand here and use this to talk?
At least one expert says there's been a spike in cases associated with all of the long weekends this summer.
There's always been this 2-week kind of afterwards where we start seeing a growth in cases. The September long weekend is no different, other than the fact that we get a bit more mobility amongst people.
The trend is in Canada in particular, is that people are traveling within 500 kilometers of their home.
A trend noted by an uptick in Airbnb bookings. Dr. Zhang Chagla warns enjoying that last slice of summer outside of the city also comes with risks.
When you're at the cabin, you're sleeping in the same accommodations, you're sharing a lot of the same objects, you're pretty much in each other's faces.
Case numbers have also increased in other provinces, with a rise in COVID-19 impacting young people.
I'm not super worried. I guess I'm just a young millennial. I don't think I'll be affected that much.
We don't want it to prevent us from, enjoying basically our lives.
Before the weather cools down and a potential second wave brings people indoors again. Talia Ricci, CBC News, Toronto.
Now, whether it's COVID fatigue or maybe just overconfidence, it's clear not everyone is listening to safety messages. So how do we get that message through to Canadians, especially young Canadians? Joining us now, infectious disease expert Dr. Alison McGeer. And how can we better reach people in their 20s, Dr. McGeer?
Well, I actually think that public health is doing a remarkable job of reaching people in their 20s. Yes, we're seeing an increase in cases, but it's not a dramatic increase, and that means that almost everybody is listening, even people in their 20s. We just need to keep it up.
And yet we definitely hear people frustrated saying that maybe we should get the police handing out tickets and break up groups. It sounds like you don't believe more tougher enforcement is necessary.
So I'm in the Bonnie Henry school of thought. I really don't think that more enforcement much of the time is going to help. This is about us being in this together and working together on this. We've seen that being remarkably effective. And I think most of the time we don't need more enforcement. We just need more messaging.
Well, lots of people in the Dr. Henry School, that's for sure. Dr. McGeer, really nice having you on the program.
Pleasure to talk to you, Ian.